Good afternoon, everyone. My paper is on the topic Safety and Efficacy of the Newer Topical Anti-Glaucoma Drug, Netazodil, a retrospective study. I have no financial interest. Netazodil, a novel topical anti-glaucoma drug, acts by reducing the intraocular pressure by increasing the conventional trabecular meshwork outflow and reducing the episcleral venous pressure. Apart from the two major randomized controlled trials on ROCK inhibitors, the famous ROCKET trial and the ROCK-J post-marketing surveillance trial, there have been few studies in literature. After its introduction in the Indian market in January 2020, there are only a few established publications on Indian patients. So we attempt to analyze the efficacy in South Indian glaucoma patients. The aim of the study is to assess the efficacy of Netazodil in lowering intraocular pressure and to analyze the adverse drug reaction in glaucoma patients over a period of 6 months. As is a retrospective study conducted at the glaucoma clinic of a tertiary eye institute in South India during the study period June 2021 to 2022. Patients who are initiated on Netazodil from the study period June to January 2022 are followed up for a period of 6 months. Data from the medical records at the follow-up visits of 2 weeks, 1 month, 6 weeks, 3 months and 6 months are collected. Patients with age less than 18 years or with congenital or developmental glaucomas are excluded. The analyzed data include demographic characteristics, the type of glaucoma, whether Netazodil was given as a primary or an adjuvant drug, the baseline intraocular pressure and IOP at successive visits, the baseline ocular surface status and the ocular surface adverse effects on the follow-up visits. Coming to the results. Analyzing the 46 study subjects included 30 males and 16 females with a mean age of 65 plus or minus 11 years. This is a pie chart showing whether Netazodil was given as a primary or an adjuvant drug. No patients received Netazodil as a monotherapy and majority of patients it was a third adjuvant. The type of glaucoma enrolled included mainly primary open angle glaucoma, followed by secondary glaucoma, primary angle closure glaucoma. The secondary glaucomas included neovascular glaucoma, steroid-induced glaucoma, and exfoliation glaucomas. The baseline ocular surface status assessment at the baseline visit showed that majority of our patients had pre-existing meibomitis, followed by blepharitis and dry eye with filamentary keratitis. This is a bar diagram showing the adverse drug reaction following Netazodil therapy. Adverse drug reaction after topical instillation of Netazodil developed in 19.56% of our patients, and the most commonest was the conjunctival hyperemia. Not the extent of conjunctival hyperemia in one of our patients who was started Netazodil for steroid-induced glaucoma. The mean intraocular pressure of the study group was 23 plus or minus 8.5 and statistically significant IOP reduction was seen at 2 weeks, 6 weeks, 3 months and 6 months with the maximum reduction at 2 weeks. This is a line graph showing significant reduction of IOP after initiation of Netazodil at 2 weeks followed by a brief rise and plateau effect between 1 to 3 months to a final stabilization by 6 months. This is a dot plot graph of IOP with successive visits showing the IOP distribution around a mean value. From the scatter plot it is obvious that we have taken a lot of secondary glaucomas with extremely high IOPs. Coming to the discussion. When our study is compared with the famous ROCKET 1 and 2 trial and the Japanese trial, the IOP reduction is comparable. Our 1 month IOP reduction is 19.3%, which is comparable with the 1 month reduction of Japanese trial. Whereas the adverse drug reaction in our study group is far less, probably because of lack of documentation as ours is a retrospective study. The major adverse drug reaction reported in our study was also conjunctival hyperemia. So the limitations are, because our study is a retrospective study, there was no clear planned protocol for documentation and there has been documentation failure. And in majority of our patients, our drug was a third add-on, so there was a significant dropout during the study period. Coming to the conclusion, Netazodil is an effective drug as adjuvant therapy in the management of glaucoma with a significant sustained IOP reduction over 6 months. Significant IOP reduction was seen in all glaucoma subtypes and major adverse effects related to the drug were not identified. These are my references. Thank you.
Okay, thank you. Is it a clinical trial or something, part of a clinical trial?
No, sir.
No sponsorship?
No, sir.
Then why you had done a retrospective study?
Sir, the study period, like we have to have some study period was done during this. We analyzed as a retrospective study, so we included those patients. The number of nitazoxanide patients who are on nitazoxanide was far less in our study, so it was only 46. So we have to go back to the medical records to check regarding the IOP at the initiation time, and the adverse effects which are following the initiation has to be got from the medical records. So we have to do it as a retrospective analysis for that.
It is not given as a primary, only second or third drug.
Yes, sir. No one was given as a primary drug.
Then why you take a mix of primary glaucoma, secondary glaucoma, everything mixed together?
Like I took a single consultant, and every single patient who received nitazoxanide during that study period was taken into consideration. So major studies which were done earlier was mainly on primary open angle glaucoma. So, but our consultants, which like they have been giving this as a third add-on to patients with the secondary glaucomas and also primary angle closure glaucomas also, who are already on 3 AGMs. So I included them also.
Okay, thank you.
How do you check the IOP in this study?
Goldman applanation tonometer, sir.
Okay.